My legal name is William Ware. I have never been called William since the day I was born. I'm Frank. By the time I was finally diagnosed, I'd seen probably 4 or 5 different ones, and finally got to a doctor who says, "Well, let's do an MRI because sometimes loss of hearing can indicate a tumor." Then Pierce called me up and he says, "Guess what? You've got an acoustic neuroma tumor uh, in your cranial cavity, a pretty good sized one."
Is Dr. Madorsky interview take one BCAM mark acoustics?
I'm Dr. Simon Madorsky, and I'm a facial plastic surgeon here at Scars and Appearance Center of Newport Beach. Of course, the significance of Frank's right-sided facial paralysis made me curious of how he even got to this point. And it's one of the classic scenarios. He had acoustic neuroma that was operated many, many years ago, which is a tumor growing on or near the facial nerve inside of his brain. They removed the tumor, but the facial nerve was too involved for it to be saved.
I lost all function on the right side of my face and lost the hearing in the right ear. I had the surgery. I was off for 4 months, and I went back to work and as a middle school principal. And the kids were great. 7th and 8th grade age kids, 12, 13, 14-year-olds, kind of get a bad rap sometimes. I love that age. I taught that age. I worked that age as a principal. I love working with those kids.
I met Frank a few months ago when he presented for reconstruction of his left cheek melanoma. It required a rather fun flap that we have pioneered here at the center called SMAS fasciocutaneous island flap. He healed great and he was very happy with the outcome. And that's when I brought up to him the fact that he had the severe consequence of his right facial paralysis.
So Dr. Madorsky came into the exam room and so forth, and took a look at the melanoma and went right over to my cheek and started pulling and tugging, and so he says, "I think we can do something with that."
I really thought he would be a great candidate for a deep plane facelift technique to correct all these issues. The interesting thing about it is the deep plane facelift technique and its recent innovations is what has driven our innovation and discovery of the SMAS fasciocutaneous island flap, what did for his melanoma of his left cheek. So in essence, the innovations in facial plastic surgery helped me not only design a great reconstruction for his left cheek, we could also use it to correct the right-sided facial paralysis. How's your speech? Is it still better?
Oh, I can't tell you the number of people who have noticed that that my speech is much improved.
Well, you healed very well. You look at least 3.5 years younger.
I'm just really grateful to Dr. Madorsky and staff. Everyone here is so nice. It's just really nice. And Dr. Madorsky is a great human being. He's got a great sense of humor, and it's really easy to talk with. And I was just actually looking in the mirror the other day and just taking a look at my face again, because previously I had that droop and that it was gone, and my face looked a little more symmetrical, kind of like I looked before the brain surgery. Yeah, other than older.